Well, hello again, and welcome to our fourth edition of the Mayor's Emergency Response Roundtable. I'm Rick West, and I'm joined by representatives from the Chesapeake Regional Medical Center and Chesapeake Public Schools, two of our agencies about which we're hearing many questions. But before I go to our guests, I did want to make just a couple of observations. I spoke to a businessman, not a local businessman today, and he shared a quote with me, which I thought was pretty amazing, because all of us are looking at our situation as if we're in a storm we can't control. It's a roller coaster. We're not sure where it's going, and all that is true. But the quote that he shared with me, I thought gave a different perspective. He said, we are, as a business community, voluntarily choosing to have our financial hardship in order to invest in the health of our neighbors. And so what a different perspective, and I think that's what we're all about in Chesapeake, whether you're from the business community, and next week I think we're going to be talking about what we're doing as a city to help and that kind of thing. But this just gives a little different perspective on it all. And I also want to just remind everyone, it's just becoming more and more important that we really do practice this social distancing. I know it's been a hardship for us all, staying 6 feet apart, not having more than 10 people in a gathering. It certainly presents many, many questions and many controversies, but it really and truly is our only hope of surviving this with the least amount of deaths and the least amount of damages. So I know there are a lot of creative ways that we're doing. You're in the grocery store line or whatever. They put taped lines down to make sure that you're 6 feet, and so it's just we're doing those things as a city, and I would just encourage everyone, no matter who you are or what your business is or what you practice, to practice that. Also, what I'd like to also remind us all to continue to support those restaurants and businesses that are doing takeouts. I enjoyed my hot dog and french fries from Uncle Al's today. They are ready to serve, and they do it in a quick, efficient way. So please try to get to visit and support those. So again, one other issue I want to go to the manager about. The council members are getting lots of emails about situations or interpretations from the Executive Order 55, social distancing, and there is a local responsibility to these executive orders that I'd like for you to just speak to, if you don't mind, Mr. Price.
Thank you, Mayor West. Yes, the governor has pretty broad authorities during times of emergency to protect health and safety. And so the executive orders are done in accord with that authority. And there's a lot of very broad guidelines in the executive orders on distancing, but some are very specific. So some specific industries were particularly called out, places where you would expect folks might congregate. And so the governor's authorities, he expressed through the executive orders, and for now, until those orders are lifted, that is the law of the land. And so we are operating consistent with the governor's executive orders. However, as I've said in the past few weeks, as we've chatted about this, we are really still encouraging people to voluntarily comply, and we've had just wonderful response from the business community and from our citizens when asked to voluntarily comply. And I got to tell you, it's actually pretty heartwarming to see people when they are engaging, maybe with the police or park rangers or city employees. They recognize what a difficult position we're in too, and I think that's great. We're trying to do the right thing trying to limit, people getting together in large gatherings, but trying to be sensitive to, these are Chesapeake residents, these are Chesapeake businesses. They're trying to make their way and they're trying to get along. So, we have some authorities under the governor's executive order, but still we're trying to educate, make people aware, voluntary compliance, and we've made suggestions to people about different ways that they can do business or different ways that they can, maybe hold the event that they're trying to hold. So we're really trying not to stop people from engaging in commerce, but to try to do it in the way that really limits people from getting together and walking that fine line between, having the authority, but trying not to exercise it.
Thank you. I certainly do appreciate that, and I'm sure our citizens do as well. So let me turn to the experts for a moment. We are very privileged to have the Chief Operating Officer, and she's also the Chief Nursing Officer at Chesapeake Regional Hospital. And she knows what's going on there, and so we've invited her to come and talk to us about some of the complications and give us a snapshot of what COVID-19 is how it's currently impacting your hospital. So please, Amber.
Thank you for having us back to discuss COVID. From a hospital perspective, although we're not seeing a large capacity of general patients, we are seeing an increase in respiratory patients, those that are persons under investigation to rule out COVID, and also the number of COVID-positive patients has grown in the last week. We do expect that growth to continue and are preparing to adjust our census, our staffing, and our capacity to address the concerns that we'll see in the future as the disease progresses through the community.
So I guess it's been commonly termed as the surge. So let me ask you, what are we doing in conjunction with the city to prepare for this surge?
Chesapeake Regional has been working with the Unified Command Center for the City of Chesapeake, and together we are partnering to identify alternative care sites within Chesapeake should the surge hit as we expect it to. We will have alternative care facilities arranged by that time in order to accommodate patient volume and patient care.
Thank you. Another question we keep hearing, because I guess we see on the news and hearing more from a federal level modeling. Do we have any local modelings that would give us some predictions or idea of where we are, what type of data that is available to where we are and where we think we might be in the future?
Yes, we are using the CHIME model, which is a model that was developed by the University of Pennsylvania. Many hospitals are using this model across the country. It is very hospital specific, and it looks at what is happening in your hospital on a given date. There's a number of data points that we enter, and based on that data and the number of patients we are treating with COVID and the number of patients that meet various other criteria, it gives us a model of prediction. And in that model of prediction, it helps us prepare for surge planning and gives us some idea of when that surge may happen. And in the current model, just as we have modeled it today, it looks like for our area, and again, it's very hospital specific, and we have opportunity to flatten that curve and maybe not see the surge that it's predicting right now. But right now, it looks like the surge will happen around the week of May 10th is when we would expect to see the largest surge of positives in Chesapeake.
And we have with us, not at the dais today, but Dr. Welch, with our health director. Would you come to the podium and stay? Because I think the next couple of, this one and the next issue, I would like you to weigh in on. Do you have any more information or any different studies or data that's indicating anything different in terms of the surge?
Well, certainly we defer to the hospital in terms of the surge analysis. So I'm on target with what they've said because I trust all of the data. But of course, even with the data, it's not a guarantee. The key, as you alluded to, is flattening that curve. And that's what's going to make the difference. And as we've said so many times, we don't have vaccine, we don't have medicine. What we have is us. And so as mundane sometimes as staying 6 feet away or washing your hands may seem, it's really what makes all the difference in the world. And so I commend you, Mayor, for mentioning, I prefer to say physical distancing because we're all human beings and we need social connectivity, but certainly that 6 feet is something that's vitally important. And what's becoming even more important now is new data that has come out saying that many, if not most, of individuals who are infected and contagious are either asymptomatic or their symptoms are so mild that they attribute it to allergy or something and not really illness. And equally as important, or perhaps even more important, that you can spread it 2 days before you even come down with symptoms. So this is new information. I'm certain that CDC is going to come out with some new changes on their guidelines once they decide how to respond to that.
So as a follow-up for that, and I'll go back to Amber as well in just a moment, testing. Where are we on testing and where should we be?
Well, I'd like to see us further than we are. I think that's probably putting it mildly. There are limited tests, and so there are criteria that go with most tests, although certainly you can get it through a LabCorp with a physician referral. A lot of the problem is the time it takes to get the test back. So I know that I think even the hospital is looking at an in-house test, and a number of hospitals are doing that because by the time we get the test back, there could have been other exposure. And our goal, of course, when we know there's a positive, is to step in, do contact tracing, and intervene immediately.
Okay, thank you very much. And Dr. Edges, did you have anything that you would like to add to that?
No, I agree with all of the statements that Dr. Welsh has made regarding the lack of ability of testing and the delays that we have experienced in turnaround times in testing. And as Dr. Welsh mentioned, at Chesapeake Regional, we are hoping to offer in-house testing in the very near future.
Excellent. That's certainly hopeful. Thank you so much for being here, and I hope you'll let the doctors and the nurses and the entire staff to know how much we as a city appreciate all you're doing, the hard work that you're doing, the preparation that you're doing, and getting ready for things should they turn worse. So thank you so much.
Thank you.
So let's turn our attention to education. Dr. Cotton, going back to my school days, I was thinking about when May came around, it was sort of like getting excited, almost like Christmas Eve. It's sort of the last surge. We're getting ready to do our testing. We're going to have our end of the year celebrations. There'll be parties. There'll be a lot of things happening at the end of the school year that are fun, but still a lot of hard work for the last month and a half. But all of that has changed with the closings of school. And so I would just like to ask you to start, and I'm going to ask our chairperson, Dr. Victoria Prophet, Mrs. Victoria Prophet, to comment on this. Dr. Cotton.
Thank you, Mayor West, for the opportunity, and it's great to be here again. I know we have received lots of questions about our instructional plan moving forward. We have been very responsive to the point that we can through our COVID-19 questions tab on our website. Last Friday, we did release our continuity of learning plan that looks like this, that we shared with all of our families and with our community. As I've shared last time we were here, we want to keep our students engaged in learning throughout the process. So we did implement the emergency learning plans, which were really just a couple weeks to keep our students engaged. We had prepared for 10 days in the event that school would close, and then it happened literally right as we finished the plan. So we implemented the 2 weeks of emergency plans, which was our phase 1. Our phase 2 is our enhanced learning plans, which we're involved in right now, and that's going from March 30th through April 10th. And we're keeping our students engaged with content they've already learned, but we're trying to enhance that content. We're trying to use more virtual online learning. Our teachers are instituting office hours with our students, checking in with our families. They're providing lessons online, and we're also providing packets because we have to make sure that we provide paper and online opportunities for our students. And that's going to run through April 10th. And everyone should be happy to know, at least I hope, that we are going to observe spring break, which is April 13th through the 17th. So we're still going to honor that period of time. Frankly, I think some of our parents would appreciate a break because they're now teaching nonstop. You know, they're doing a lot of hard work, and our our parents are doing an awesome job. So I just want to make sure our parents know how much we appreciate all that they're doing. And then, of course, we're going to move to our extended learning plans in phase 3, where we're going to start introducing some new content. We're going to do more online, but we always have to continue to provide the paper versions, packets for our students as well. We'll talk a little bit more about that when we get into our technology discussion, which I know is coming up. But I do want to give a shout out to our teachers and staff and administrators. Really, overnight, they've had to completely change their mindset as to how they're going to deliver instruction. And I also want to make sure that our families understand that there's no way that we can recreate a full day of instruction through online or other means. So obviously, we're trying to work with our families on the most essential skills that they need to reinforce and learn, and that's a much abbreviated time period where that happens, because I've heard from some of our families and even some of our teachers who think that we have to log on and teach for 6 hours, and that's not going to help anybody. So we want to make sure that we create creative opportunities for our students to move forward, and even though the time engaged with the teacher is less, the learning and the extension of learning is still going to be powerful because it's relevant, and we're focusing on all of those skills that we want our students to master, the 5 C's that we always talk about: communication, collaboration, creative thinking. All of those things are promoted, and it's a work in progress. And so far, this week is going well, but I have to tell you that last week parents told us we weren't doing enough, and this week they're telling us we're doing too much. So we're trying to work through that balance. And I don't think we'll ever make everybody happy, but our goal is to keep our students engaged in learning.
Yeah, I think it kind of reminds me, we tried many years ago, tried to write a homework policy, and the same thing, you had people who were saying too much, too little. I do recall studies that looked at the amount of engaged time that kids at different levels actually have in school, which is surprising when you start breaking down, time you prepare, get your materials out, you go to lunch, and how much in a 6-hour day is really unengaged learning. So I don't think that parents should get too upset about exactly how much time. It's really what they achieve, and some kids can, like you could probably get it in 10 minutes. It might take me 2 hours. So, the amount of time is not as, I think, as important as the results. Thank you, Dr. Cotton. And so we also have our school board chairperson, Victoria Prophet. Ms. Prophet, what is the school board doing to look at helping those kids or dealing with those that do not have that internet access?
Thank you. It's my pleasure to be here. Equity is always a priority for Chesapeake Public Schools, and we've worked hard in the last several years to make that happen. This situation has caused hardship for many families right now, and we don't want to add to that stress of the situation by leaving families out, especially those without the internet access in this process. Dr. Cotton and our leadership team have created a great plan to help meet the needs of those learners through our phased approach, as he mentioned, and a part of that process involves distributing technology, and we're going to be doing that by distributing technology as early as next week to some of our students.
Thank you very much. And Dr. Cotton, you kind of alluded to this on your first appearance here, talking about promotions and people that, what you are doing about kids being promoted to the next grade level. Have you developed any more in terms of grades and the promotion policy?
We have, and as a matter of fact, we are going to provide some additional guidance next week. I have already put out the message that our seniors on track to graduate will graduate, and of course our students will progress to the next grade level as expected. One of the things that we're going to spend some time talking about a lot next week is grading versus learning. I know a lot of our parents are getting caught up on, is this going to be graded? Because all of us who are teachers, we know every time you give students something to do, they raise their hand and they say, is this going to be graded? And does this need to be in cursive? So those are the kinds of questions that we quickly hear as an educator. But we also want to make sure that we're focused on learning, not just the grading. So we're going to be providing some some clarity as we move into next week. And I know that we've received a lot of questions from our community related to that. I'm excited to tell you that we have already started assessing all of our seniors, our guidance counselors and our assistant principals for instruction, our principals at all of our schools have taken a look at every one of our seniors individually, and we're determining what they need to meet graduation requirements. I'm very encouraged by the number of students. There are very few of our students who are not on track to graduate, and that doesn't mean they won't graduate. It means that we have a little bit more that we need to do and a little bit more that the students need to do to meet that expectation. So we're excited about the initial numbers that we've received as we've done our analysis. We are going to be reaching out to those individual students to talk about exactly what they need. And if I can go back to what Ms. Prophet was talking about with the technology access, even though we are going to provide technology devices to our families, we're focusing on our seniors and our high school students, because in order to get those credits, we need to deliver some of that instruction virtually. So we need to make sure that our students have those devices. I have received inquiries from families and parents of elementary and middle school students, and most likely we will not be delivering devices for those students. We'll be continuing to provide online and packets for those students to continue to be engaged in learning, but our priority has got to be our seniors and our high school students. So, but we will reach out to them directly because we can't have a bunch of people showing up to get a device that would not be in line with the guidance that we've been given. It will have to be by appointment to make sure that we do not have great crowds of students and families coming to collect devices. But we are going to reach out directly to families to assist with that. But I also want our parents to not worry about the grading. We are going to provide, as I said, some guidance on that. I've had parents who've reached out to me and said, you know, I have no idea how to teach this math, that it's not the way it was when I was in school. There's a new way that we're teaching it, and I've had some grandparents and parents who are raising children in the home, and they're exasperated by all the work that's involved in those kinds of things. We want to ease their burden and just keep our students engaged. Our teachers are doing a phenomenal job of reaching out to families and talking with students and checking in on our students. And I'll just put in a plug for our teachers. You give them a challenge, they will meet it. And our teachers, once we allowed our teachers to move forward and do what they do best, they've knocked it out of the park. So I know they'll continue to work with our families, and I just want to ease their burden about grading. We're going to give more information about that next week.
Good information. It's interesting. Maybe parents will appreciate more after this is all said and done how difficult a job it is for the teachers. And so, you know, part of public education, well, mainly public education to exist to teach our kids stuff. Another large part of public schools, and the part that I probably enjoyed more than I should have, is the socialization part, right? I had a conversation with a member here, employee here, one day at the elevator, and talking about her daughter's a senior, and they're missing the good stuff, the prom, the celebrating the successes, which I talked about earlier. Ms. Prophet, any thoughts or ideas about that at this time?
Yeah, we are, as a parent myself of 3 Chesapeake Public Schools graduates and 1 just last year, my heart goes out to those seniors, and still having 3 young people in my home. It's heart-wrenching for a lot of them. I've read a lot of their stories that I know personally that they have put out on social media and how it has affected them, and it's devastating for most of our seniors who really look forward to this milestone. They look forward to all of the things that go along with being a senior in high school. They look forward to the proms and the graduations and all of those things. And this disruption, we hope, will not diminish their accomplishments. We know that it's not celebrated the way they usually would, but we really hope that it doesn't. And we're going to find a way to celebrate our seniors in these coming days. That is, we're not going to let them go by without being celebrated, and we are going to look to what we can do in these coming days to celebrate them.
Excellent. I'm pleased to hear that. That's awesome. Thank you very much. So, any other thoughts, Ms. Prophet, before we move on?
We just want to let our parents and students and the community know that we are partnering. We have a lot of families that are in need. And in this crisis, we've got a lot of families that weren't in need before COVID-19 and now have become in need because of losing a job or being laid off temporarily because of COVID-19 for whatever various reasons. And we have put out on our website, as well as Peach Jar and Twitter and every social media we can, where they can get assistance. We have flyers. We have meal sites with our community donations. The first week that we had the food trucks and the packets out, I know myself and Dr. Cotton, along with a few other board members and some community leaders, were actually there to witness. It was running smoothly. It was done well. Some was drive-through, drive-up, where they could get the food they needed for their children as well as the learning packets. We're continuing to do that, and we have extremely expanded on that. So we're even going into some neighborhoods and some communities as well as our schools. We have additional food support. If we have any need, you can text food to 877-877. And they will be responded to as well. We also have assistance from our United Way and other community leaders if any of our families need assistance with utilities, with rent, any of those, et cetera, as well. If those are the things we've set up for those that are in need, if you're on the other side of that coin and you're able to help with those needs. We have donation items and drop-off sites. We have for individuals, for corporates, donation as well, if you're able to donate. And the corporate donations are done through the Chesapeake Public Schools Educational Foundation, as well as, and we also have a place for monetary donations as well. So if you're able to help with any of our families, with any of our students, with all of these plethora of needs that are going on right now that are unusually high, we would love that support and that partnership.
I'm really glad to hear you explain the many different ways people can help or get help. That was one of the things that we keep hearing throughout our city. And in fact, our next program is going to be sort of centered on that kinds of things that the city is doing and ideas that we might get from community that would help with that. Dr. Cotton, any final thoughts?
I think Ms. Prophet covered it well when she talked about the community support. You know, what really encouraged me is right after the first closure happened, I received lots of communication from several community partners and families and parents and community members who wanted to volunteer and provide support. And we have channeled all of that to our Educational Foundation and Partnerships Office, and that has been well coordinated. And I'm so excited that we've been able to provide lots of support to our families and our community. I also would like to thank our Chesapeake Public School family. Everyone's pulled together in this difficult time to support one another. And the most important thing that we worry about are the children. Are the children okay? And that's our number one focus. So we're making sure that we're doing everything we can to keep our children safe and keep our students engaged throughout this process. We are posting lots of information on our website. I think almost overnight, our website became the hub of lots of information and frequently asked questions. We get lots of questions every day, and we publish answers to those on our website and our frequently asked questions. And I know there'll be more questions as we move ahead. Even though our offices and schools are closed, we are still open to serve our families. I know the city manager has said that many times about serving the community. We're the same way, that even though our buildings are closed, we are answering email, we are answering messages. We are here to serve our community, our students and families throughout this period of time. And we have lots of ways that folks can contact us through that COVID-19 tab I told you about, but also our 547-1033 hotline number that we share as well, where we'll answer questions as they come in. And I have to tell you, some parents are just reaching out to me for advice and information, and sometimes they want to vent about all that they're going through, as we all are. So we're here for our families. So I just want to make sure that they're aware of that. Our buildings are closed, but we're here. Thank you.
Mayor, one more thing I wanted to mention with the help. There's out in social media, it's called Faith in Chesapeake, and it's where our local churches and all across the city have partnered together with Chesapeake Public Schools, having food dropped off, having supplies dropped off, even supplies that we normally wouldn't give in the school setting. And I saw photos of the ones this morning at Portlock, and it's just amazing how our churches have really come alongside Chesapeake Public Schools and are really helping us to get all of the items, toiletries, the church, all things that our families are needing that might be going without at this time.
And I cannot thank you both enough, and Amber, you as well, for being here. And Dr. Cotton, you're exactly right. You provide so much information on the website, and we do the same, which I'll talk about that and encourage people to go to it. And all of that is wonderful. But there's no substitute for people hearing out of your mouth what exactly you're feeling is and what you're and information. So I appreciate you being here so that people can understand, our citizens can understand that we're struggling and looking for ways to find new avenues in this unprecedented time. So thank you all for being here today. I want to encourage our citizens to be cautious when you share information. Always make sure it's from a reputable source. Such as the city, the schools that we just talked about, the hospital, the health department. You can find links to all of these on our cityofchesapeake.net/COVID-19, and you'll see many of those sites on screen in just a moment. So join us again for our next roundtable on Tuesday, April the 7th, when I'll be talking with representatives from the Department of Human Services and Chesapeake Integrated Behavioral Health Care. So until then, stay safe, keep your distance, and stay home. Thank you very much.